Good afternoon, everybody. It's 3:30. We're going to try to start on time only because we kind of have a longer presentation and we suspect that you guys are going to have a lot of questions for us, so we don't want to be rushing at the end. My name is Joyce Cooper. I work for the Los Angeles Public Library. I'm a principal librarian and I work at the Central Library in downtown Los Angeles.
Good afternoon. My name is Alicia Moguel. I'm the Associate Director of the Department of Lifelong Learning for the Los Angeles Public Library. And we'd like to start our presentation, but just before we start, we did hand out evaluations that we would like you to fill out before you leave. I'm going to be starting with the origins of our program, why we decided to create this program, how it came about, and what role we have in this. So why did we start The Source, which is a program to work with our homeless population at the Central Library? One of the main reasons was that the Central Library is located in downtown LA and is just a few blocks from Skid Row. So a lot of our staff were already familiar with many chronically homeless individuals coming into the library on a daily basis. In fact, we found out that approximately 300 people without an identifiable address walk through our doors every day. In the early days of our initiative as well, our Health Matters initiative, we had contracted with a health expert to work with us to determine the different health disparities that affected our residents. And it turned out that homelessness was among the top 5. So then we also surveyed our branches to determine if and how chronically homeless, let me go back. If and how the chronically homeless used the libraries. And so it made perfect sense with all the information that we had to create a program that addressed one of the disparities that hadn't been addressed up to that point. Previously, we had already been working with some other of our partners on different programs that addressed the other various health disparities that we found out that affected our residents, such as the more usual ones like diabetes, hypertension, things like that. So how the program came about, in early 2015, I made efforts to reconnect with the Department of Mental Health and the Los Angeles Homeless Services Authority to start a conversation on how we might partner to better serve the chronically homeless population that frequented the Central Library. And as conversations went on, and the Department of Mental Health and the LA Homeless Services Authorities understood our situation, they decided to go ahead and pilot a program with us. And other organizations at that time were also brought to the table to help plan out the pilot. The library's role. Part of the issue with getting our partners to agree to work with us was the fact that they really didn't understand the library's role in this sphere. They really didn't understand how the library worked with these people, everybody who come through the door. They didn't understand that we welcome everybody, that public libraries, as you all know, are usually places of refuge for the homeless population. We're an official cooling station in the winter, we're official cooling station in the summer, and we're warm in the winter. We offer free amenities like free Wi-Fi, computers and internet. And really, our staff strives to treat everybody with dignity and respect, no matter who they are or where they come from. So once they really understood these reasons and they came and saw for themselves, it sort of clicked with them, and they decided to embark on this journey with us. So if any of you endeavor to do something similar, just be prepared to explain the expanding role of your library as a core community, social service, and education center.
So now that Alicia has explained a little bit about why we wanted to do this, I want to talk a little bit about why we wanted to do it in terms of staff. So the Central Library is one of the largest libraries on the West Coast. The Central Library employs, just in the subject departments, about 180 people. We have 12 subject departments. And so a lot of the subject departments were dealing with the homeless community day in, day out, and they were feeling a little beleaguered. They were feeling like nobody was listening to them and they didn't have any support. So once we did the survey and we realized that about 300 homeless individuals or so every day were making their way into Central Library, we really realized that we had a need and we needed to address it. So the source really gave us a tool to help support staff, make them feel like they had, somebody looking out for them, that we understood what they were facing. We also used it as a tool to reach out to local social service organizations to see if they could come in and help our staff deal with some of the issues we were facing. And, it kind of helped the staff not feel so alone and not feel helpless about interacting with this community. And up until then, a lot of our interactions, were negative. And I think our staff didn't want them to be negative all the time. So interestingly enough, after we had started the source for a few months, actually almost a year, Mayor Eric Garcetti, the mayor of the city of Los Angeles, also announced that he had a new initiative to combat homelessness. His goal was to end homelessness. And the source had already been going on for a few months, so it fit really nicely into his initiative. One of the things that came out of this was that the mayor recognized this library, because we aren't what you typically think of as the agency that would be dealing with homelessness. But we were already doing, we already had a creative solution. We were already partnering. So it worked really nicely into the mayor's initiative already.
Okay, and partnerships. I touched upon it a little earlier in mentioning how it took a little bit of time for our partners to come around to work with us. Partnerships and developing partnerships was kind of a challenge. We really had to make them realize what went on in public libraries every day. And developing a partnership is actually key for this program, because it's through their services that we can help our patrons. So developing a partnership is kind of like developing a relationship. It takes time, it takes months, and I think having patience and persistence in doing that will really pay off. Another perk from developing these initial partnerships with mental health and with LASA was that when we wanted to expand the source or develop partnerships in other areas of health matters, they were actually able to get our foot in the door with talking to other agencies that work in this sphere. We had tried that earlier, and a lot of times they just didn't get it. They didn't know why would we want to work with a public library? You have books. People come in there to read. So it wasn't something that immediately came to them, but through these partnerships, they advocated on our behalf. So when we wanted to work with them, either to expand the source or others, they were there saying, you know what, you really should go to this meeting with the library because they're doing some really great things. So that helped us in the end. This slide basically is just to illustrate what our partners currently work with right now in the system to combat homelessness in LA County. This slide basically is going to show you the road to housing. Our partners typically engage in outreach, hoping to reach homeless individuals. Once they develop some kind of trust, they get enrolled in the coordinated entry system, and then the agency helps them get all the types of identification and services that they need. As you see here, Social Security, driver's license, mental health services, Medi-Cal, TB testing, that kind of stuff. And then once the caseworker works with them, they send them to all these different offices. So really, the burden is on the individual to go through and become match ready through the coordinated entry system. So for those of you who don't know about the coordinated entry system, it's basically like a match.com for homeless services. I mean, it scores and ranks individuals, it assesses them, and it ranks them according to risk and vulnerability. So that's sort of a little bit of what homeless individuals need to do to get themselves housed. And there's been a lot of difficulty for them to get their birth certificate, to get an ID, and things like that. So that's kind of what they were working with. And part of the reason why they agreed to partner with us is because we all decided we wanted to do something different and more creative to help combat this mess. So Paul actually was one of our first clients in the early days of our pilot. By the time he came to us, he was angry and frustrated. He had been sent to multiple agencies across the city and county, and oftentimes he was either turned away because he didn't have a particular piece of paperwork that they wanted prior to them helping him, or the person he was there to see wasn't there that day. So what we were able to do in that event was to partner him with a Department of Mental Health outreach worker who shepherded him through the event and took him to each table where he was able to sign up with DPSS for Medi-Cal and for CalFresh. And he was able to talk to Social Security Administration to work on whatever Social Security ID he needed that he didn't have. We had DMV that day, so they were able to get him a new identification card that he had lost. So all of these things came into place and helped him move more quickly through the process of getting housing. So we found out the following month that he had been matched because of the efforts at this program, and that he had been given a date to move into his new home, and that the following month we heard he was going on job interviews. So it was this early experience that really convinced our partners to continue working with each other and with the library to break through a lot of the barriers that homeless individuals have in order to get off the street.
So now we're going to talk a little bit about the components of the source. So on the screen, you'll see a sign, and this is basically the sign we put out every time we have a source event, and it lists all of the services that we provide. And on any given month, we may have different service providers. Right now, we're having some issues with DMV coming out every month, so that tends to change. But for the most part, a lot of the ones towards the top are always there at the source. So this is the first thing that people see when they walk into the source. It's kind of a menu of what's available for the day. We have some of our pamphlets that we give out and we use to promote the source. We also recently came up with like a homeless services pamphlet that kind of details like how to help you get all these services when we're not at the source. So if you need to find a place to take a shower, if you need to find a place to store your stuff, the pamphlet has all of that information that's location specific to the Central Library downtown. So the source actually began on December 22nd, 2015. It was a soft launch. We didn't really promote it in the community. We wanted to see what would happen. The partners that initially signed up with us for the source, the Department of Mental Health and the LA Homeless Services Authority, we all agreed to pilot the source for 3 months and see what would happen. And then we would revisit it, and if the service providers and the library still felt like it was worthwhile, then we'd continue the program. The target population was a chronically adult homeless population that lived in the on the streets immediate to the Central Library. And it worked out really well. We ended up with, quite a big response that we were not expecting. So it continued on. And so now it's been almost 2 years since we started the source. Some of the basics of the program is we hold the source once a month, and it's always the 4th Tuesday of every month. So we put the dates on a flyer that we distribute around the library and also around the community so people know when the source is. We hold the source for a 3-hour time period, so the source is from 12 to 3 p.m., the 4th Tuesday of every month. We were doing early registration, especially on days when the DMV is here, and they're really, really popular. So on the days when DMV is there, we will actually start registration at 10 a.m. because we hand out wristbands for everyone, because DMV isn't able to see everyone that shows up. But people that need to get a free identification card, we can get that taken care of. But we will do early registration for that. Otherwise, we just start registration at 12, and it's, first come, first serve. It's an open, fair format. When we first started the source, we were using 2 meeting rooms at Central Library, but we quickly outgrew the space. It was too crowded, too many service providers, too many people, and we were all kind of stepping on each other. So we decided to move into the outside courtyard space at Central Library. So now everyone's set up like a fair. So tables in the courtyard, and it makes it much easier to navigate the service providers, and also gives people space to kind of spread out. And one of the unique aspects of the source is that we do pre and post meetings. So before the source begins for the day, we meet with the service providers. We have them tell us a little bit about their work, what they're hoping to achieve that day. We talk a little bit about the library. Then after the source is over, we get together again, and Alicia usually leads both meetings, and she talks to them about, what their experience was that day, how many people they saw, if they placed anybody, and what are some suggestions for next month's source. And one of the really important components of the source is that a lot of the work is done by library staff. And it's not library staff that we assign. For example, my job now in the source, my big job, is I get to staff the check-in table. So that's my big responsibility, is finding the staff to staff the check-in table. And pretty much it's just asking for volunteers from the staff. And one of the things that has amazed me about the source is how willing people are to help, and how some of the staff that had usually had negative interactions with this population are totally down for volunteering for the check-in table, and they walk away from it like positive and encouraged, and they actually enjoy their time helping out. And finally, all of the work that we get from our partners is in kind. So we're not paying any of the partners to come. There's no financial incentive for them to be at the source. If they're at the source, it's because they feel like it's a worthwhile effort for them to be there. And we really appreciate it. So this is an infographic, and we had handouts over at the front, so if you weren't able to grab one, there should be one at the front, and it kind of has this information. Because the source is so popular, we've actually expanded it to 2 other branches. So when you include all 3 source events that are currently happening every month, we've helped over 1,500 people get connected to services, to nearly 4,000 resources, and we've had over 28 events in almost 2 years now. The graphic here shows the wide-ranging services we have. So when Alicia was talking about CES, so the coordinated entry system, we've had 391 unique entries into the coordinated entry system. So that's 391 people that are now in line to hopefully receive housing. We've connected 279 patrons to mental health services, and we've had 445 referrals to other services, among other things. There's some other stuff on there, but you guys can see that in your flyer. So, as far as the source goes, we kind of feel like this has been a success. One of the things that I mentioned was that because Central Library Source was so popular, we actually expanded it. So recently, we've expanded out to the Exposition Park branch, which is in the southern central area of Los Angeles near USC. We've also expanded out to the Will and Ariel Durant branch, which is in the Hollywood area. And both of those branches were also seeing large homeless populations. Some of them, like Durant, for example, was seeing a lot of younger homeless that needed help. So that was one of the reasons we wanted to go into these branches. And in just a couple of weeks, we will be launching our 4th source event in the Venice area. So at the Mar Vista branch, which is Venice adjacent. So they will be also providing services to that population that needs it. Let's see. So Expo Park opened in December 2016, and the Will and Ariel Durant branch in Hollywood opened in March 2017. And we've had a lot of visits from other library systems that have wanted to come and, learn about the source because they want to replicate it. What we're hoping is to take a lot of this and turn it into a model that other systems could pick up easily and kind of replicate in their system. So, we're hoping it'll work. Touching on something I mentioned earlier, the source has really empowered the staff because I think for a long time they felt very helpless. They felt like nobody was listening to them. They just were really down about the whole situation. They were seeing a sharp increase in the amount of homeless population that were, in downtown LA. I mean, and you've seen the statistics for downtown, for LA in particular. Our population of homeless individuals has just exploded. And so our staff was seeing this, and they weren't really seeing any solutions, any way to make this any better. And we were constantly having a lot of issues with security, some issues with some patrons that maybe were experiencing mental illness. So it was just kind of taking its toll on the staff. So I think having the source and letting the staff volunteer at the source has really given them a tool. It makes them feel more engaged. It gives them something to kind of work with. And even if they're not specifically volunteering in the source every month, the fact that it's there gives them something to refer patrons to. And that makes them feel good. So they're not just telling somebody, I'm sorry, I can't help you. They can give them information. They have a pamphlet they can give them now. So here, this is information you can use for right now. And on November 28th, we will be here to help you. Please come back. So, and I think that's made a world of difference in our staff. And, you know, and I think it's interesting that the people that have volunteered for the source have been the people that were really negative about interacting with this population, and this has really kind of changed their mind. One of the things that we have, you know, that we've accomplished with the source is that we've gained new partners. I think a lot of times people don't realize that the library is a partner in this fight, and that, you know, we are a core component to social services to this community. Several organizations have initiated contact with us because they want to be part of the source now. And if you look at the picture, this is a picture of, we have something called Ticket Clinic that comes in every month, and they help people that have misdemeanor tickets get them off of their records. So if they got a ticket for jaywalking or for maybe having their stuff, you know, before when LA was ticketing for that, the Ticket Clinic comes in and helps them clear this off of their record. So this is a picture of the staff, and they're really popular. And that day, they had helped their 202nd client of the day. I mean, of the time they've been at the source. So it's been really effective.
It was that day.
It was that day.
That day.
That day.
That day. Yes.
And one of the things that also we're proud of is that in 2016, the Urban Library Council recognized us as a honorable mention for health, safety, and sustainability. So that was a big kind of plus for us. It really helped us made us feel good about what we're working on. And finally, a tangible kind of result of this is that 7 people have been permanently housed, and several of the people that have attended the source have been employed. So we actually do feel, I mean, 7 doesn't feel like a big number, but when you're working with this population, 7 is huge. So it's been really good for us.
Okay, I'm going to touch upon some of the challenges that we've had and some of the challenges we continue to have. One of the challenges that we've had is getting service providers to the table. Didn't show up. Click again. Okay, there we go. Like I mentioned initially, the public library was not something that many of our partners thought they should partner with. We were just a place that housed books and had computers for people to use. They really didn't take into consideration our philosophy of serving everyone, no matter who they are, who walks through the doors. So that was a particular challenge. And so I'll reiterate what I said about relationships and developing relationships with organizations. It takes time and it takes patience, but it's well worth the effort. Another challenge we had was convincing city and county agencies to work with each other. We are a city library. We're a city department. Department of Mental Health and the Department of Public Social Services are county agencies. So when we approached mental health, they were very reticent, not only because we were a library, but because we were also a city agency. So that was another challenge and a wall to break down with conversations in them. I think once they understood the goals of helping homeless get from street to home, and they knew that we were willing to partner with them and that we were flexible in what we wanted to do with them and that we wanted to create something unique that would help them break down barriers and move people through the system, then they were willing to work with us. Another challenge is, as Joyce mentioned, was getting staff buy-in. As she touched upon, a lot of staff members at Central Library had some negative interactions with the chronically homeless who were mentally ill and acting out. So what we had to do was not only talk about the source with them and what it was and what our goals were, but we asked them to participate in the event so that they can experience and see what we were doing and connect with our partners as well. Another challenge was we're currently working on is tracking attendees to show real impact. Joyce noted 7 individuals that we know of have been housed through the source. We're able to easily track, how many people attend the source, what services they get. But one of the difficulties that we've had and that our partners have had in this space is keeping track of clients and tracking them all the way from beginning to the end until they get housed. It's really difficult for our clients who work in this space to stay connected to this population because they're very transient and they move around a lot. So even they have a hard time letting us know who's able to get housed and who's not. So we're actually currently working on something to break through those barriers. And another challenge is how to sustain for long-term success. This requires a lot of legwork from my department. It requires us to continually keep in touch with our partners, and we think that the pre and post meetings that Joyce touched upon earlier are really important because it allows us at each event to talk about the source, to talk about how we can improve it, to talk about who we might need to have come to the table so we can offer those services there. It allows us to talk about problems that the agencies have with each other, trying to work around barriers and red tape. And I think that is how we really keep our partners engaged, because we're totally willing to be flexible, and everybody who comes to the table at each event is willing to be flexible to try to work around the barriers that they have within their organizations, to the extent that they can, to get the person moved on to the next phase to get housing.
So now that we're going to finish our second year of the source, we have some challenges moving forward that we're trying to address. The first challenge is looking at developing new partnerships. So far, we've been lucky that we've pretty much had a steady, kind of core group of partners that have been working with us, but we also need to plan for the future when maybe some of them can't work with us anymore, or their priorities have shifted and maybe they're not as engaged in outreach anymore. We also, look around and we notice that there's other groups kind of new to the scene that may be doing work that we should be reaching out to and engaging in the source. Another challenge that we're looking at is expanding our services. So a few things that we're looking at is how do we get hot food into the source? Right now, currently we provide refreshments, so we get hot coffee for them and sometimes like a snack or something. And hot coffee for this population is like wonderful. They're so happy with hot coffee, but we wish we could do more. So we're looking into maybe trying to get hot food for them. We're trying to see if we can find a provider that can maybe have clothing that we can provide to some of our attendees. Other health services, currently we're doing mental health services, and on needed basis, public health is coming and doing like flu shots and things like that, but we need other health services. We also need to expand our workforce development to help more people get into jobs. And so we're just kind of always looking to see what we can do to help meet the needs of this population. Finally, we are going in on a grant called the Productivity and Investment Fund through LA County, and this grant hopefully will help us develop, like Alicia said, a better system to help track who's coming into the source, what services they're receiving, and what their progress is through. And so hopefully we can have better results and better assess what the impact of the source has been on this population. So if you're thinking of creating your own The Source at your library, we have some tips and advice. The first is to be ready with your pitch. When we first started talking about this, it was a stretch of the imagination for many people to think about the library as a social service hub. But for us, it made complete sense. So if you're thinking about maybe having this service, you need to be ready with that, because a lot of people are going to come back to you and say, well, you're a library. Why are you doing this? And so, for us, it took a lot of work to kind of get our message together and say, well, this is why, because we have 300 people coming in here every day, and we have to do something to help them. We also, I would suggest reaching out to other agencies, especially in the same municipality. So if you're a county library, reach out to your county agencies. If you're a city library, see what the city's already doing, and reach out to them and see if they're willing to partner with you. Engage your entire library system. Let everyone know what's going on. There's no way the source could have been effective if the entire central library didn't know what was happening. Why? The fourth Tuesday of every month, all of these people showed up, and we were, kind of taking over the library. If people don't know what's happening, then they don't have buy-in, and they're not going to talk about it with staff and patrons. and when working with this population, you do have to be practical, so you do have to keep facility and security issues in mind. I will say that in 2 years, we have had very, very few security issues come up at this event. People are just they're happy to be there. The staff's happy to be there. It's a positive interaction all the way around. We've had very few incidents, but we always make sure to have a security officer available. Somebody from LAPD is always on site the day of the source, and they can help with crowd control and, just in case something comes up. Also with facility issues, we don't have this event near where the children's areas are or any of, because we don't want to risk that interaction just in case. So try to think about where you're going to put this in your library. Maybe don't put it right next to the children's room. That's probably not the best place for it. Refreshments for attendees, like I said, hot coffee is awesome. Everybody loves hot coffee. And it really kind of sets the tone for the day if we are able to provide them with refreshments. And a lot of times when people come into the source, the first thing they want is their coffee and their little bread, and then they'll go talk to people. It's like once they have that, it's like, okay, I can deal now. I can go talk to people. And finally, not finally, but one of the things that we also suggest is keep an open mind. Make sure your staff keeps an open mind. It doesn't do anybody any good to have people at the source or have an event where the staff is going to be making faces at the population or being negative about it, or coming in with preconceived notions about what the population looks like or should be like. We want everybody to come into this with an open mind, and they're more willing to be positive and to engage with people respectfully. Finally, you have to be willing to do the work. This didn't happen overnight. Alicia, Christina, who also works with Alicia, myself and a whole bunch of other people have put a lot of work, especially Alicia, into making this work and getting this off the ground. So, don't get discouraged if it doesn't happen overnight. It does take work.
And that ends our presentation. So we have our contact information here. If you need to reach out to us, have any questions that we're not answering right now, please feel free. If anybody has any questions now, we do have time.
Yes. Do you want to go first?
Oh, sure. When you rolled this out to the branches, was there anything that was different in terms of implementing it to the branch libraries? I'm assuming maybe the size is different. I don't know. This is like a smaller version of what you were doing at the central library?
Yeah, all the branch sites that we chose, we kept in mind the facility. It had to have a meeting room that was a fairly decent size, and of course, the population was key. So we kept all that into consideration, and we worked closely with each branch to talk about how to set up in their space and how to do the work. And we also helped bring in partners for this, for them.
Is that why Mar Vista instead of Venice?
That is why.
You had a question? Yes.
So what's the impact been in the library on the days that you're not having the source? Are you seeing an increase in the homeless population?
That's pretty interesting. We do not see an increase. That was one of the big fears and some of the pushback we got from outside agencies, outside people. But, no, we have not. We have this event on the same day each month, but we have not seen this, especially at Central Library being so close to Skid Row, we don't see an influx greater than what we normally do on a daily basis. Incredible as that is.
But I will say that it's been interesting that we've had a lot of word of mouth. So once people start coming to the source, they'll tell their friends, and their friends will tell their friends. So we get a lot of people that come into the source that say, oh, my friend told me about this and told me I should come to the library. So we haven't seen an increase in the population, more than usual, but we have gotten a lot of questions from people that heard it from a friend. Did somebody?
Yes, I was just going to ask, how did you provide services? Did you have people go into Skid Row or go to the rehabilitation centers to talk about the source and the programs that you have?
You mean to promote our event? The partners that we brought to the table, we really asked, because a lot of them have street outreach teams, so we asked them to promote while they were doing their street outreach. And we also promote through our means, so that's how we got the word out.
Yeah, and because the program was specifically tailored to the people that were already using the library, we put flyers out in every subject department. The librarians often mention it to the staff. Actually, everyone mentions it to the people that come into the library and say, "Hey, did you know this is happening?" So that's how we get a lot of people in.
So the ultimate goal is this path towards finding housing. So that's, so I was just wondering if you ever have other people with other issues that just end up coming there that day.
Yes, yeah, absolutely. I mean, you know, the goal is to get people housed, but we also serve people who are at risk, who may not be homeless. We serve anybody who comes in who maybe they lost a job, they need to try to figure out how to get CalFresh, or they need to get on Medi-Cal. So we don't turn anybody away if they qualify for any of the services.
Oh, wait, I think she had a question.
Yes.
I have a question about, you mentioned you have the police officers there at each of the source
Uh-huh.
sessions. Is that something that's actually helping to improve the relationship with the police in your local homeless community, or is it something, like, does it turn any people away, like when they see an officer there?
LAPD's relationship with the homeless population, especially in downtown, it's been interesting because LA has really backed off on prosecuting. Like if people have stuff on the sidewalk, if they're sleeping on the sidewalk, they're not really going, they're not doing, anything. You don't get a ticket, you don't anything. So I think that that's improved the relationship. At Central Library, we have a patrol officer pair stationed at the library every day anyway, so that walk through. So I think our patrons are kind of used to seeing them now, and it hasn't really caused an antagonistic relationship with the population. I think they're just like, oh, it's not a biggie anymore, because I think they're used to seeing LAPD around, because LAPD actually does go into Skid Row quite a bit and just walks around, checks on people, makes sure everything's okay.
There's someone in the back who has a question. Yeah, actually, the source is surprisingly one of the more consistent events that happen as a Homeless Connect Day in the city of Los Angeles. So the fact that we're operating on the last Tuesday of each month, these people remember that and they'll come back. We also have pamphlets that we hand out that list local resources that they can take advantage of, like going to places to get a hot meal or to take a shower. And we are working to expand to have, social workers possibly and LASA outreach workers come by on other days other than the source.
Yeah. Yeah, so the LASA outreach workers usually, we have a large homeless population that kind of hangs out in the gardens outside Central Library before we open. So often in the mornings, they'll just go through there and touch base with people and see if anybody needs help. And they'll come into the library sometimes too during the week. Yes.
And the pamphlet that you're referring to, where do you get the resources? Does the library do research for that? And then how often is it updated? Because some things may go away.
Yeah. When we created the pamphlet, we did all the research. I'm looking at my staff member. We only included evergreen type resources that are there. So Midnight Mission, Union Mission, they've been there forever. They offer showers and hot meals. The DPSS office, the local office where they can go and get help. Things like that. We are very careful not to include new up and coming things that may not be there tomorrow, and we do check periodically.
Anybody else with questions? Oh, yes.
What specifically did you say to your community partners to get them to the table to realize?
Well, the conversations were initially, hey, we have this chronically homeless population, and if you know what the definition of chronically homeless is, it means that these people resist assistance through normal means, and that a lot of them have mental illness that is not being taken care of. And at first they were like, really? We don't think so. Are you sure? No, you're a library. So it really took several meetings, and it took about 3 or 4 meetings over the period of 3 or 4 months, and also having them come out and take a look at who came in our doors on a daily basis and how we interacted with them in order for the light bulb to go off.
Yeah.
So yeah, it takes time developing that relationship. It's all key. Any other questions?
Yes.
Talk a little bit more, I noticed that you started talking about the tracking, and what you were thinking about and how that might
Okay.
show the impact.
Yeah, Joyce touched upon it a little bit in the Productivity and Investment Fund grant through the county. The Department of Mental Health was so excited at the success of this program, but still frustrated about the lack of control that they all had to really track people going through these services. So they are currently working on a software program with funds from this grant that will be allow their outreach workers to keep track of people who come in through the source to see where they are and allow them to be case managers. And if you know the system, there's a case manager for each person once they're entered through the coordinated entry system. But if they leave whatever boundaries that organization serves, then they no longer interact with them. But this will allow anybody who has access to this software to check on this person. They don't have to be the case manager, but they have access. So like if they go to any source throughout the city that we have, then that person can check on them and they don't need to be the case manager on file and have special access. So that's going to help us kind of bypass the walls that they're coming up against right now. Yes.
Yeah.
So they register for the program when they get there. What type of information do you get?
At the check-in table, we're basically just asking, I'm sorry. We're just asking for their name. We ask them for their date of birth. We try to find out what the first year of their continuous homelessness is. So many of them, if they're chronically homeless, this may not be the first time that they're homeless. So this may be the current time they're homeless. So we try to find out when this run of homelessness started. We also try to, we ask them for their gender, for their ethnicity. We ask them if they have a cell phone number, and that's basically it. And most everybody gives us the information. They're pretty good about it. The only issues we have sometimes is if someone's maybe having a hard time, like, understanding what you're asking for. They may be having a bad day, and they might not quite get what you're asking them for. So we try to get as much as we can from them.
What languages do you provide the service in?
At the check-in table?
Anywhere throughout the...
It's usually English or Spanish. We haven't had really anyone else request language assistance other than those two languages.
Is there always somebody to translate it necessarily?
Yes.
Mhm.
Yeah, we have staff people. Yeah.
Mhm. Yes.
I'm sorry, I'm not fully aware. So this coordinated entry system, so that's a system that exists in Los Angeles
Yes.
to provide social services.
Yeah, the coordinated entry system is what LA County uses to move people into housing. So it's their system to make, to track people, to make sure they get all the data that they need to be matched for housing.
So your idea is to put these groups all together in a place where the homeless already are and make it easy for them to access this help.
Yes.
Yes. What? It looks like we're almost out of time, so we have time for one more question. Otherwise, we thank you very, very much for coming, and please fill out your surveys and drop them in the box over there, and make
back
sure to
table.
grab a flyer. Does anybody have one last question? No? Oh, yes.
So I'm in Long Beach,
Uh-huh.
which is in Los Angeles County, but you had a hard time getting county people to come to you. You're in the city of LA. What advice would you give me?
Be persistent. Try to find the name of somebody within the organization that does the work or manages the people that do the work that need to be done. So usually it's somebody who manages the street outreach teams, and then have a conversation with them. Also, LASA should be in your area, and have a conversation with them. They're well aware of what we do. And so you might be able to get in the door that way, and it'll take a little bit of time, but if you're persistent, they'll eventually come around if they see that there is a need.
Yeah, we have a group.
Yeah. All right. Thank you, everybody.
Thank you, everyone.